Hi, welcome back to State of Bergen County 2012. And our healthcare discussion, we're joined by doctors to the left of me, doctors to the right of me. Dr. Nancy Mangieri, who's Director of Public Health in Bergen County, my left. My right, Dr. Lisa Tank. And both of your titles are longer than we've probably got time to talk about, but you want to tell us what your title is?
My title is I'm the head of geriatrics at Hackensack University Medical Center, and I'm also a director at Medical Affairs. And part of my job is also education. I run the geriatric fellowship, UMDNJ fellowship at Hackensack.
And we'll talk a little bit more about why geriatrics is so important in Bergen County. But Dr. Mangieri, I'm going to call you both by your first names, if that's all right.
Please.
Can you tell us a little bit about public health in Bergen County? What's your role and what's the state of public health in Bergen County?
Absolutely. I am the Director of Health Services in Bergen County. I'm also a local health officer to 28 separate municipalities in Bergen County. Out of the 70 that we have. We contract public health services out to municipalities. In some cases, we are a county-wide facility as far as environmental, hazmat, HIV, tuberculosis, those things we do countywide.
So what do you really do as public health officer?
My job is to oversee the delivery of all of the services that public health has to offer, which is surveillance of disease, which is the protection of the public, the education of the public about disease, and our job is to collect statistics and to make sure that all of the laws and the regulations in New Jersey are followed that relate to health ordinances.
So specifically then to promote a healthy population, health literacy, is that a part of your?
Oh, absolutely. Cultural competency is very big for us. And making sure, and currently we're engaged in a marvelous project, and it is the John Snow Incorporated is a company that was hired. The 5 hospitals as well as the Bergen County Department of Health Services have joined together to do a community assessment. It's an 18-month community assessment. It's the first of its kind in Bergen County. It will be incredibly comprehensive and give us some really good insights into where we have the needs, the gaps, so that we can begin to address those with programs.
That's fascinating. Are you seeing anything so far?
We have got some preliminary results on it. So far, we're not really surprised at the results, but we understand that as they move through the population, and they are addressing many of the minority issues, they're looking at populations that don't usually get surveyed. They're really making an effort to get out into the community. The hospitals are required by the IRS to do this community assessment. So we are working together with them, and the collaboration is unique. And we are really, really all going to benefit as a county.
I think when we look at Bergen County, most people in New Jersey think of it as certainly a highly populated county. You have a big population, pretty affluent population, pretty homogenous in terms of race, ethnic origin, but maybe that's an incorrect perception?
Well, first of all, Bergen County has about 911,000 people. So it is the most populous county in New Jersey. It does have its affluent side, most assuredly it does, but it also has the other side of that as well. And our job is to make sure that that population is connected with and serviced so that they too can benefit from all of the services that are being offered in the community. And we work in partnership with the hospitals so that they can deliver all of the services that they do, move them back into the community, and then we can assist them. And this is especially true in mental health issues and in addiction issues. We are definitely the people that drive making sure that people are connected to those programs, and we're continuing to work to make that even better.
And Lisa, why don't you tell us a little bit about the programs at Hackensack University Medical Center? And I know that you're one of the highest rated hospitals in the country.
Absolutely. Hackensack University Medical Center was recently ranked in the top 50 in the U.S. World Report. And one of the things that Hackensack started earlier on is to really get care, affordable care, across all the networks. So one of the things that Hackensack Hospital has done is really network with hospitals in different counties and really develop programs such as low-cost programs so that we can access individuals who are below the poverty line, who can have access to health care. One of the biggest drive was mental health, second was dental, It's amazing how dental health, it is difficult to achieve, but so that was a program that was developed at Hackensack. And one of the major things that the hospital has done is also networking with community clinics, which are one of the most common places that people do visit. As
When you say community clinics, does Bergen have any federally qualified health centers?
Yes, they do.
They do.
They
Okay.
do. There's one. There's North Hudson clinics, which also provide low-cost care and referral services to individuals in the community.
But there are other community clinics in addition to the FQHCs.
Absolutely.
Okay.
Yeah.
Let's talk a little bit about the Affordable Care Act, which is something that may not seem too much a part of your life every day, but certainly from your perspective, we've had this act now in place for a year. It's been upheld, and depending on which way the election goes, may be further upheld, or we may be back in chaos over this again. Do you see a difference? Has this made a difference to the hospital and to the people that you see?
I think the Affordable Care Act, one of the things that it really set out to do, it's one of the historic changes in, I think, healthcare. What it has done is it has made people aware, especially physicians, that the culture is changing. It's not all done yet. There's part of it where physicians are providing care as a community now, no more fragmented care. This is care which is going to be, number one, high quality, efficient. It is going to be transparent. It is going to really focus on cost.
And that's for hospitals that have made a transition to the accountable care organizations, right?
It's both, because if you look at the ACA to provide, in the ACA to provide that kind of care it advises is you'd require the ACOs. So they work in hand in. Hackensack Hospital is an ACO, one of the 27 ACOs, and they participate in the shared savings programs with Medicare and Medicaid.
And I think most of us, or many people, don't understand that the Affordable Care Act actually, in addition to just requiring that everyone has health insurance, has a lot of requirements for hospitals and for physicians.
Absolutely. I think one of the, for the ACA, for the Affordable Care Act, one of the major requirements is for the hospitals to develop networks and to provide care, to provide access to care to low insurance, low income groups, no insurance groups, and all ethnicity and overcome language barriers. That is one of the biggest challenges.
Yeah. So from your perspective, do you see, does the Affordable Care Act have an impact on the services that you can provide, or the patients that you see, or the public health in general?
Actually, this act is going to change public health because it is many millions of dollars have been put aside for prevention. Prevention is what we do. Education, prevention programs. They're looking to increase the infrastructure of public health, which has long been underfunded. So for us, the Affordable Care Act is a light that says we can begin to develop more and more of our prevention programs and deliver them into the community, because our partners, the hospitals, are counting on us to be prepared in the community to be able to do that. So we are very excited about the community building aspects of the Affordable Care Act.
So what specific things would you look to see in Bergen County? What are some of the health areas? You mentioned mental health. What are some of the needs of the population in Bergen County?
Certainly obesity, tobacco cessation, diabetes. All of these, we're all familiar with them. We all know about them. We just have to continue to try and find ways to deliver these positive education, this information to the population. We're beginning to use social media as a way to begin to connect with not just the young people, because that really isn't true. There's almost everyone's on social media
Even
now.
old people have Facebook.
Even
now.
old people, exactly
Yeah.
correct. And so instead of just making brochures, we now are doing YouTube-like, with perfect content information in them, videos, because it's proven that if someone comes onto our website and clicks on a video, they'll stay there 10 times longer than if they're just reading text. So we now have the opportunity to capture their attention and to deliver good, solid information to them. So we're very excited about that, and we're working toward that from a variety of angles.
I would assume you work closely with schools in Bergen County as well.
Oh, absolutely. Not only do we work with them about health education, but we also do something that's very important to public health, and that's immunizations. And we do the auditing for immunizations in schools, and we work with all of the schools to try and increase that. There's also a program that New Jersey has, which is called the New Jersey Immunization Information. It's a database where every child that's immunized, the physicians are required to place that immunization into this record. We as public health can go into this database and we can begin to see how well we're doing with getting children immunized and where we need to focus our energies to increase those numbers.
And I want to come back to that and talk about immunization and some of the concerns about that shortly. But I want to get to you, Lisa, and
Sure.
talk to you. I know that you work with the geriatric unit, and you mentioned some amazing statistics to me that Bergen County has a huge aging population.
Absolutely. Bergen County actually is one of the leading counties in New Jersey, which has the aging population. And 1 in 7 person is over 65, and one of the rapidly growing groups is 85 and over. So in geriatrics, you're never old to me, first of all. And you have...
That's good. That's good news.
So it's young, old, middle old, and old.
Okay.
And the fastest growing is 85 and over. That's the middle to the old.
So if they're not moving to Florida from New Jersey, they're moving to Bergen
Yes,
County.
they are
is it?
moving to Bergen County, and one of the biggest reason is the services that the county provides for seniors. And one of the things that we have noticed is though they are more rapidly growing, they're also one of the biggest part of the community that's giving back. So they're volunteering more. They're more involved in the hospitals actually, where they're coming back and giving back to the community.
So what are some of the specific health needs that are associated with an aging population?
I think the specific health needs, one of the biggest needs is the prevention. Though it's very commonly thought that because you are 70, there is no preventive things left, but one of the biggest thing is preventive care and health maintenance. We, as you said, immunization is major in an older and an aging population.
And what kind of immunization?
And we're talking about immunization such as every year the flu shot, that is important, the influenza, the pneumovax, shingles, one of the another.
Which still, how many people actually get the shingles vaccine?
Very few, and and that's where the barriers are. So if you look at the community, it's an affluent community as it is said all over, but there is a major part of the population that is not yet aware of all the services that the county provides, the federal programs provide, the eligibility for these programs. One of the programs that we had, and the reason I found out this is as a fellow at Hackensack, one of the programs that we had started was house calls program. So the physicians went out and made house calls in Bergen County. We did it for about 8 years. And that's where you really get to see that how Bergen County, how affluent it is, but at the same time, there's a major part of the population that has no access to care. Transport, one of the biggest things that my patients say that they would help. Nutrition, obesity in elderly is still very high. Alcohol use, dependence is one of the major, I would say a major screening tool that is not done. But it does affect a lot of compliance and follow-up care.
Now, the elderly population is, say, 65 and up, Medicare eligible.
Yes.
And actually more provisions under the Affordable Care Act for them to get the annual screenings, the annual physicals. Are people taking advantage of this, do you think?
I think people are taking advantage. The people who are have health literacy, and that also is defined as, it's very subjective, what health literacy is. So we all, the 4 levels of it. The question is, how are we providing this information to them? So is the language that we are providing to these patients and population out there, is it simple enough for them to understand?
How many different population groups, ethnic groups do you work with, say from the hospital's perspective?
I mean, we work with insured, also with charity care. That is a major part of the...
And how many, not just non-English speaking, and how many different...
Oh, you mean language?
Yeah,
ethnic, we have worked with a whole variety of language, and especially Hispanic, African Americans, and Asians. Bergen County is one of the largest growing Asian community.
The Korean population, actually.
Absolutely.
Freeholder mentioned this morning.
So Hackensack Hospital and Holy Name Hospital and all these communities are very, big growing population of Koreans.
So you're the safety net, really. The hospital charity care is a safety net for this. Do you think the safety net is working in Bergen County? Do you think that generally you're meeting the health needs of the population here?
I don't think we can ever say that we're meeting all the health needs of the populations because there's just too many gaps. Because when we talk about that, for me, that's more of a holistic approach. And although we might be taking care of them physically, are we taking care of them as well for their mental health issues? Depression is huge in the elderly. We need to have better screening tools. Our young population is suffering as well with increased suicides, increased use of prescription drugs. These are the sorts of things that I would love to say that they're healthy and we're giving everyone what they need, but we can never really rest on that. We have to make sure that we're always finding those pockets of issues that we need to continue to address. Again, depression, addictions of all kinds. These are things that we need to make a difference, and we need to have awareness, and we have to begin, and one of the hardest things is removing this stigma, is having people actually reach out to get the resources around the stigma, and that's a job that public health takes very seriously.
You mentioned that you're also the public health officer in 28, I believe,
Yes, 28 municipalities, yes.
Out of 70, which I had
Yes.
no idea before this morning that there were 70 municipalities
There are.
in Bergen County. How do you begin to coordinate with a system that's that large?
The public health system is very unique and interesting in Bergen County. There are 13 health officers. Some cover one town, such as Paramus. And then there are some, like myself, that have a group of them that come together. Then there's also regional, where a health officer comes in and has 10 or 12 towns, and they're not associated with a municipality. They're an independent health officer, and they come in and put together a group of towns as well for shared services. So the delivery of public health in Bergen County is challenging to understand.
There are a lot of layers to get
There
through.
are a lot of layers. We do animal control in 37 towns, although I'm only health officer in 28. Because what we do is we try to make our public health services available. The county has a large health department with great depth and knowledge and very, very, very educated and long-time public health employees. So we try to share that wealth whenever we can, but it's a contractual agreement. We cover all of the county facilities as the county health officer. So whenever there is a major issue, such as a hazmat issue, those are things where we respond across the county. And we provide those services for the other health jurisdictions as well.
And we talked in the first panel, the discussion on the economy, about the move to shared services and consolidation.
Yes.
Because everyone's concerned about property taxes. And one of the biggest barriers with many of the local services is that everyone wants to see their own school or their own police force. It seems that in public health, you don't really go out wearing I'm the Ridgewood, public health officer. It would seem like that's one of the easier areas perhaps to consolidate and to coordinate.
We are looking at bringing those services together and being able to deliver them countywide. As an agency, we believe that the delivery of these services through a county-wide effort would save dollars and would take all of the valuable resources that we have in public health and all the public health professionals that we have, bring them together and be able to deliver those services in a more economical manner.
Go ahead, I'm sorry.
No, I was just going to say, and that's why some of our programs have already turned over to that, such as the HIV programs, the TB programs that are funded by grant dollars, which are available to all of the people in Bergen County.
And from your perspective as the hospital and the safety net, if you will, for this, I mean, obviously with that, I would think that would make your job much easier, the more coordination there is within the local level.
Absolutely. Coordination is everything. Talking to the agencies, I mean, as she said, that having just conversations and exchange of information, that is our biggest challenge, I would say, is to exchange that information going back and forth between the county services, mental health services, the hospital services. So if there is that coordination, which is, I think, happening, as you said, but we are never perfect, but there is a safety net that does catch a lot of this, but we are nowhere near to get everything. So I'm glad that we are doing a project that is going to find these gaps, because there are multiple gaps in the community.
What is something that you're doing that is a positive thing that you're excited about? I mean, we talked about the challenges, but I'm sure that there are things that you're doing that are producing results as well.
I think one of the biggest things that that we do at Hackensack is work also with developing what are called a patient-centered medical home. This is one of the biggest endeavors from the hospital and from the ACO. And what that does is that, again, provides very focused care to the patients in the community. It reaches out to, for geriatrics, it's 65 and over, but it
for everyone,
spans for everybody. And it develops, one of its biggest thing is to develop resources with the county, develop with case managers, social services. How do you reach out to and print information?
Well, the concept of a patient-centered medical home, which is just there's one person or one facility, the medical service that you use, the provider that you use, really oversees all of your health care.
Coordination of care.
Yeah,
it is absolutely coordination. But coordination of care was defined till now as talking to consultants for that patient. It's no longer that. It's way beyond that. It is reaching out, as I said, to, again, community services, prescription programs, making drugs, making prescription drugs available at a low cost, talking to pharmacies in the community. How are they working with the hospitals and with the ACOs to develop that? So it's kind of breaking the silos. There are no more walls in healthcare.
As a physician, are you excited about this?
Absolutely.
Or is it something, I would think that these days, if you go to medical school with all of the difficulties that you're going to encounter with insurance and all of those things, I mean, it almost seems like you have to be incredibly dedicated to want to be a doctor anymore.
I mean, young kids that are coming through, one of the advantages we have is because we are an education program, an academic center. What we see is medical students coming through and asking these questions. And one of the most important thing is that the curriculums are changing. We are trying to teach the young kids, the students, that this is the future. You're going to have to be culturally competent. You're going to have to be aware and sensitive to the minorities. You're going to have to know what are insurance programs, where are the barriers, how are you going to reach out and take care of chronic illnesses.
Because if you want to be an effective physician.
Absolutely, absolutely. And kids are excited. But I would like to bring up one thing, that as we develop these services, as the Affordable Care Act is in place now, with the ACOs coming up, and people are getting more insured. The biggest
Hopefully.
challenge,
if we have a health insurance exchange.
I'm hoping. But one thing that's going to be is the health delivery system. How do we have younger physicians, as you said, still be excited in primary care?
And how do we find primary care physicians in general, right? Because
Right now,
of the shortage.
absolutely. Right now, there's a shortage of geriatricians. So there's already programs have closed because of either finance or young students are struggling with loans for becoming
So as our
primary
population
care.
ages, we have fewer and fewer physicians who are equipped to deal with that.
So we have, we work with organizations such as ACP, New Jersey chapters, where
ACP
is American College of Physicians, and they have been a big supporter of developing really going to Capitol Hill and talking about these issues, that let's make medical schools more affordable. Let's have minorities do medicine, so that when they become primary care and they speak the language, they're going to be able to reach out to and we have, I would say, cultural competent care. So that's
And I know that working with nurse practitioners, perhaps working with people to enlarge extenders who can extend, do that, the medical care
right.
is important as well.
It's absolutely very important. But the important thing again is you got to speak that language. You got to be able to communicate at a health literacy level that exists in the county, and that's going to make the most effective delivery of care.
And let me ask you from your perspective, Nancy, I want to get back to the whole issue of vaccines and vaccinations. Autism is a huge concern in New Jersey.
Yes.
And the fear for the longest time, which has now been disproved, but I don't know how many people actually know that autism is not really linked to vaccines. Do you find that that's still an issue that you deal with in the population as you're, I mean, kids have to be vaccinated to enter public schools.
Well, actually, you're right, that myth does still exist. People care deeply about their children, they're concerned for their health and their safety, and so they have questions. And our job is to help them get accurate information, scientific information that they can believe. As far as whether or not autism and vaccines are connected, it's just one of the challenges because not all children are required to be vaccinated in the schools. There are exemptions. There are religious exemptions and there are medical exemptions. And we work with those people to make sure that we protect those children if indeed an outbreak occurs. So when I spoke before about auditing, what happens is we make sure that the school nurses are aware of the children that are not immunized in a school so that if there is an outbreak, and pertussis has been a persistent problem over the past few years, and they have come out with a vaccine that's given between 11, right after 11 years old, to boost it. But one of the biggest populations that is not accepting the vaccine is the older population who believes that that's a childhood vaccination and it's a childhood illness. And unfortunately what's happening is they get it and then they pass it on because many of them are caregivers of younger children.
Right.
So we're working to educate them. We're working to educate them that getting your pertussis vaccination as an older adult is very important. So one of the other things that I wanted to discuss briefly was how public health is the agency that brings you preparedness. We are the people in an emergency who have the equipment, the knowledge, and the process to be able to deliver preparedness issues to the community. What to do in case of an emergency.
What kinds of emergencies?
It could be anything from a natural disaster to a bioterrorist attack to just a large event. Like just yesterday, I believe, there was an explosion in East Rutherford. And my hazmat team went out and they did the decontamination process to make sure that when those patients were transported to the hospital, they were not a danger to the people at the hospital. So behind the scenes, when no one really sees what's going on, public health is there preparing and making sure that we have not only the tools that we need for humans, but for animals as well. Because we have a whole group called CART, and CART is a program that makes sure that if there's a huge fire or someone is hoarding animals and they go to the scene, those animals can be removed and safely brought to the shelter in their jurisdiction.
So that's the kind of work that people notice if it's not there. They
Exactly.
don't really see all the work that goes into the preparation and...
Exactly. And that's one of the main functions that public health does is this emergency preparedness and planning. And we want the public to know, and one of the ways that we draw them in is through volunteer programs such as the Medical Reserve Corps, where what we do is we reach out to older people in the community who at one point had some medical background, and we ask them to come and volunteer, and we educate them and we teach them how to respond in an emergency. And now what we've done is we've expanded that corps to people who are not medical, but people who are good with the media, people who can work with computers. So what we're doing is we're putting together an army of people who can assist us because certainly there's not enough public health professionals to take care of 911,000 people. Plus it's important to remember that Bergen County is the exit strategy for New York City. So if something should happen, they're going to march through Bergen County, and we need to be prepared for that as well.
I would assume that there was probably a huge impact here from 9/11.
Yes.
And are you still dealing with the results of that? How did that impact you?
Yes, and I think that how it impacted us was not so much in our resources as in giving us awareness of how important mental health is after an incident like that. So there are corps of people that are now trained to go on site to give comfort to people who are suffering from anxiety, depression after an event, so almost in a post-traumatic stress situation. So as horrible as these events are, if we can get a positive outcome from them and understand what we could do, we believe it's a
The
positive.
increased awareness is
Absolutely.
just huge.
Absolutely.
And how are you coping with, you mentioned the mental health needs, not just in the aging population, but with society in general, given stress over the economy, things like that. How is the hospital dealing with that?
I mean, the hospital has developed, again, the community outreach programs through the mental health programs. But for aging population who have seen World War I, II, and have had this disaster of 9/11, post-traumatic stress disorder has been on the uprise. There's also been a lot of, especially patients who have cognitive, who have dementia. They actually, when they have mild cognitive impairment, these kind of disasters actually have much more impact.
How do you define PTSD, post-traumatic stress disorder, for an older population? I mean, what would be the characteristics, and how do you determine that?
I mean, the characteristics are pretty subtle, but at the same time, it's more anxiety. Anxiety, having higher incidences of depression, difficulty coordinating their care, overwhelmed with simple things. That's how it really comes out. There's a lot of issues with behavioral that come out. Bipolar disorders get, people who've been well controlled do get offset by certain things like that. So the post-traumatic stress disorder in elderly comes out in very subtle instances, and one of the biggest important thing is to recognize it early, treat it, and have a support system.
And physicians, I would assume, are much better now at noticing that and diagnosing.
Absolutely. I mean, there are screening tools now, especially for geriatrics. A part of a geriatric assessment in Hackensack Hospital involves a depression screening, involves a lot of questions about how you are, activities of daily living, instrumental activities of daily living, really basic things. How are you functioning? How is your environment? Because remember, most of these stressors also come from the environment you live in.
Right.
And that's one of our biggest things is for the coordination of care and continuum is to support that.
And when you talk about the environment they live in, you're not necessarily talking about the geographic.
It can be
environment.
geographic, it can be homes. When you look at low income, they are being exposed to things like lead. So we do focus on things.
Is that an issue in Bergen County?
I think there are some areas that still have that, not as much. But when we made house calls, that was something that was brought. And our biggest resource is the county and senior services, where we do make phone calls and find out which areas are more exposed.
And can you give us an example of the way you deal with the cultural competency, which you mentioned is so important now for physicians? What would be some examples of where you've had to really stretch to be able to deliver services efficiently and overcome cultural barriers?
I think the biggest cultural barrier was, again, during house calls for us. For certain cultures to have a doctor come into their home, into their own environment was very difficult. We had also struggled with getting interpreters to come out to the homes with us. So that was where we really felt that there was a barrier. We overcame it by reaching out. Hackensack hired multiple interpreters that could provide services, and also having education materials that are simple to read, at the same time in their native language, and really developing plans of care for them.
And more than language, there are also, even once the language barrier is overcome,
Right.
there are still cultural issues.
Absolutely.
Right?
And cultural issues go way deep. There are certain cultures who do not, I'm going beyond geriatrics now, the other way is asking for prenatal care. A lot of cultures don't do that, but that's important for overall, maternal and fetal health. So that the cultural competency is a process, and it starts really from the caregivers, educating them to really overcome those barriers and then move forward from there.
So really it's education and information, and all the things you mentioned. Clearly social media is different, you're using that much more. Are there other things that you're using now, or ways that it almost seems like kind of an overwhelming, how do you ever begin to educate people and get all the information out there that you need to, and make sure it's received,
Well, that's the challenge, but it's also the excitement of it as well. Technology has helped us enormously, and we are looking more and more toward technology to help us deliver these cultural and these linguistic challenges that we have. We have computers that someone can type in what they want to say, and it translates it automatically. In the case of our tuberculosis, we would give people who need to have directly observed therapy every day a laptop computer with a camera on it, and the nurse they would turn it on at a certain time, and the nurse would watch them take their medication.
Because that's really proven to be the most effective way to deal with TB.
Absolutely,
right?
that's absolutely correct. And by the way, they're leaning toward that for some other conditions as well. But yes, it's very labor intensive, but the results are worth all of the effort that's put in. We at the health department went out and we have language companies that will translate for us in 23 languages. We have language companies that we can call on the phone, and all we simply do is tell them what language we need, and then that patient and that person. And the beauty of that is that in the past, when we were using family members, there were areas of sensitivity. If I wanted to ask your dad whether or not he may have been exposed to HIV, I don't necessarily think that would be an appropriate. But that was one of the ways that we did it, and so our competency in cultural as well as confidentiality is growing all the time, and the technology tools are helping us to be able to do that in a more professional manner with professional interpreters.
And obviously all that takes money and funding as well.
Yes, it does.
And how do you deal with that? You just put your budget request in, I guess, which is a lot. How do you deal with the competing needs for funding?
Well, we identify, we review our programs, we look at their performance, we see how well the money is being spent and how these services are being delivered. We're always looking for grant money that can meet some of those needs, but once we find them, we have to then prove the need. So we prefer to find the need first and then go after the grant money so that we can match it.
It's a pretty measurable, though. A lot of things you're dealing with are very measurable.
Very measurable, very measurable. And it's our responsibility as county employees to make sure that the tax dollars are being spent in the best way. And by that I simply mean is that we have to have outcomes, and we have to know that these programs are delivering what they're costing us.
Exactly. Well, we are almost out of time, so let me just ask both of you if you want to make a closing statement about the level of health generally in Bergen County, what you would like to see. I always ask people if they had a magic wand, what would you most like to have to really improve health for everyone in Bergen County?
I think Bergen County is ahead of the curve when you look at other counties for seeking healthcare, being more literate about healthcare. But if I did have a magic wand, one of the biggest things I would like to see is developing more preventive care. Because if you have preventive care and you also have ability to treat chronic illnesses, we are going to see a major change in quality of life. Because that is the most.
If you could impact that, because
you can impact that. It's not the acute conditions that are, that bring more patients to the hospitals. Our goal is to really keep them out of the hospitals, functioning day to day, enjoying their life. One of the things that we talk about in our geriatric visits is setting goals. What do you want to do? If you are 85 and nobody knows how long you're going to live, our job is to make sure that we maintain your quality of life, and what are the things you want to do. So that's my magic wand, to have people who have contributed so much to society, to have help them stay active and function.
I make them understand, but there are things that chronic illness can be treated.
Absolutely. Chronic illness can be treated, and it's never too late to go to your physician. It's never too late to seek medical care, mental health care, and supportive services that the county has to offer. So it's going to be media, and it's going to be IT reaching out and developing that awareness.
And from your perspective, if you could do one thing that would really improve the quality of health for everyone in Bergen County, what would that be?
I would very much like everyone to know that we have already in our possession many tools to help them. We have many educators who can deliver the Stanford University Chronic Disease Self-Management course. We're looking and going out to communities to try and tell them to spend their dollars on evidence-based programs that deliver self-management to people.
And how is that delivered specifically? Through senior centers, through schools, through?
It can be delivered if you bring 12 to 15 people over the age of 18 together. We can deliver it to the caregivers. We can deliver it to anyone, because chronic disease is the difference between your quality of life. So the doctors, once you're ill, can help you with that. Our goal is to try and give them the tools to understand their chronic disease and self-manage it, so that they stay out of the hospital and they stay out of expensive medical solutions. And we currently have that in our possession and are eager to deliver it to the communities.
So increased health literacy sounds like the #1 goal here in Bergen
Yes.
County. And it sounds like you both are well along the way to accomplishing that. So thank you so much for being here with us
Thank
this
you.
morning.
Thank you for giving us the opportunity. Thanks.
And that concludes State of Bergen County 2012. Thanks so much for being with us today.